Hello and welcome to this educational video series. If you look at the disorders that affect growing children, some of the most important disorders are classified under the umbrella term neurodevelopmental disorders. These are conditions that affect brain development either during pregnancy or during delivery or during the early stages of childhood. One such common neurodevelopmental disorder seen among children is cerebral palsy. In this series, we will try to ask questions related to this disease, its symptoms, prevalence, treatment, rehabilitation and other aspects, and try to get more information about this. In the first episode, we will try to understand some of the fundamental concepts related to cerebral palsy. Come, let us meet our expert.
Neurodevelopmental disorders are the disorders which affect the development of the brain, and they are commonly seen in children. Some of the common neurodevelopmental disorders which are seen are intellectual disability, autism spectrum disorder, attention deficit hyperactivity disorder, tic disorders, specific learning disability, and cerebral palsy. Cerebral palsy is a group of disorders which can affect movement and posture, causing activity limitations. Means it will cause restriction of the movement of the child, which are attributed to non-progressive disturbances which occur in the developing or the fetal brain. Means most of the time the insult would have occurred when the child is in utero, during pregnancy, or at the time of delivery, or in the initial first year of the life. That is cerebral palsy. Usually they have associated other conditions or comorbidities like intellectual disability or epilepsy or vision hearing issues or musculoskeletal problems. Cerebral palsy is a very common disorder which we see in children. Around 18 million people in the world are affected with cerebral palsy, and the prevalence worldwide is around 2.5 to 3 per 1,000 live births. Means for every 1,000 live births, around 3 children are affected with cerebral palsy. In India, the prevalence is around 2.95 per 1,000 live births. In urban population, the prevalence is around 2.2 per 1,000 live births, whereas in rural population, the prevalence is around 1.8 per 1,000 live births. And there is no discrimination between any gender in conditions like cerebral palsy. It usually affects both male as well as female kids. And when compared to Western countries, in India the prevalence is slightly higher as compared to that in the Western countries. Cerebral palsy is classified based on the part of the brain affected and into spastic cerebral palsy, dystonic cerebral palsy, ataxic cerebral palsy, and a mixed pattern of all these 3 types which I have mentioned. So spastic cerebral palsy means there will be stiffness in the body, and we can further classify into hemiplegic cerebral palsy where only one half of the body is affected, diplegic cerebral palsy where both the limbs are affected, like lower limbs are affected, or quadriplegic cerebral palsy where all the 4 body parts, all the 4 limbs are affected and the child is stiff from the whole body is stiff, and triplegia only when 3 limbs are affected, we call it as triplegia. These are subtypes of spastic cerebral palsy. So dystonic cerebral palsy means child will be having abnormal posturing of the body. The child will be twisted. It could have apostotonic posture like arching, like a bow and an arrow you might have seen. So the child might have an arched back as you see in the bow. So that is dystonic cerebral palsy. Another thing is ataxic cerebral palsy where they have difficulty in walking and they have issues like they'll have very imbalance while walking, like they walk like a drunkard. Ataxia means walking like a gait like a drunkard. So that is one of the least common form of cerebral palsy. So we can have a 4th one where they can have combination of spasticity, ataxia and dystonia. These are the types of cerebral palsy.
This concludes the first episode in our series on cerebral palsy. In this episode, we got information about neurodevelopmental disorders in general and about cerebral palsy in particular. What is cerebral palsy? What is the prevalence of cerebral palsy? How is it classified? Etc. We'll be back with our next episode. Namaste.